a lot of GPs are questioning at that point, questioning of why are they doing this, what's it for, because of the stress and pressure that they're under. And most people don't go into being a GP to make lots of money. They go into being a GP because they want to look after their patients, because they genuinely care about contributing. And I think the ability to do that with all this administration, all the burden, has become much more challenging. And the rewards that's there for GPs to do so is much less so. So the stress that they're under, and you see lots of things about GPs, not doing this, and there's the junior doctors strike. You see a lot of negative talk about that. It's very disheartening when people are working 12, 14 hours a day, 6, 7 days a week. So I think there is a sense of a change that's happening where GPs are starting to question, and what would that look like? And I think we're seeing that in society generally, a shift in terms of how people want to operate. So moving to a more salaried role, a more 9 to 5, that sort of idea, which is completely in conflict with the 10-year plan, which says we're going to have 12 hours of access 6 days a week. So it'd be interesting to see how that evolves. I think there is a lot of anxiety that actually it isn't a rewarding job anymore. And for people who want to help their patients, and if they feel that they're hindered, why continue to do that and incur the stress? I would like to say I don't think that's all GPs, but I think the work has become much harder to be able to do what we were doing 10, 15 years ago to look after patients. There's a lot less autonomy and a lot more strings around that. In terms of the ARRS, I think ARRS has been very helpful at managing the fact that there aren't enough GPs. So the target range is to have 1,800 patients per GP in a GP practice. And at the moment in London, we're something like 2,500 patients per GP. So the ARRS roles help support GPs in other ways, but it doesn't replace that role. They're additional roles. They're not the role of a GP. And my fear is that we don't give enough value to how instrumental that role is in primary care, and not supporting it enough.